Hi, I'm Satya. See me at jensatya.com. I work in alternative medicine, alternative counseling, and healing. And for many years, I've worked with Lyme disease and chronic Lyme disease. And in this video, I'm going to explore the similarities I'm seeing between treating COVID patients over the past several months and my experience in treating Lyme disease over the past many years. I hope you find it useful. Blessings. The first similarity I see is around the challenges in testing. It's been historically challenging to test for anyone dealing with Lyme disease. And while initially patients may test positive if they have all the classic symptoms without a lot of underlying disorders, most of my patients over the years have had challenges being tested appropriately and testing positive for Lyme, even though all of their symptomology clearly was pointing to Lyme disease, including the classic rash that many patients get, the classic bullseye rash. And so over the years, we've had to deal with the fact that a patient may not test for Lyme disease, and at the same time, most of us who have treated Lyme disease for many years will treat them according to their symptomology. And I feel blessed to be a homeopath because I treat people a bit differently than standard medicine, and I can treat the individual and not the disease. And what we're seeing with COVID patients is something similar, where we're having so many challenges around testing. At first it was because we couldn't get anyone tested, and now we're finding so many challenges within the testing scenarios that a lot of people who clearly are having COVID symptoms are testing negative for having COVID. And then what do? Well, being someone who's treated Lyme disease for many years, I once again treat the individual, not the disease, and most of my standard medicine colleagues do as well. So we're finding ways within this process to do the best we can for our patients, and at the same time I see that as a similarity with having treated Lyme disease for years, and I'm hopeful that it will get better as days go on. The second similarity that I'm seeing has to do with chronic COVID, and that's what I'm terming people who are not getting better once they get sick with COVID-19, with SARS-CoV-2. And what's happening is after months of being sick, they're exhausted and they don't know what to do to feel better. And because we're so new within this path of treatment, doctors often don't know what to do to help them. I've seen this with chronic Lyme disease for years, and it's debilitating not only physically but emotionally, and not only for the individual and also for their families and their loved ones, because watching someone be sick and not knowing how to take care of them is challenging, and being the individual who is sick and not knowing how or when you're going to feel better is challenging. So one thing that I've found useful over the years, being someone who works in alternative medicine, is to encourage people to utilize all of their options. So often we see medicine as either standard medicine or alternative medicine. And I've been blessed with the experience of being integrative and working with some wonderful doctors over the years in tandem to help our patients feel better and not be limited to one form of medicine when we have so many options that could be useful. So one of the things that I hope we find in treating COVID going forward is that we utilize all of our options instead of this medicine or alternative challenge that we fall into. A third similarity that we're seeing in treating COVID is with Lyme disease. Lyme disease doesn't just hit one thing. I've seen clients over the years, including myself. I had Lyme disease and I had nervous system Lyme where I was having seizures. And so I've seen clients with seizures, I've seen clients with stomach issues, I've seen clients with hormone issues, skin disorders, all of these related to Lyme disease and chronic Lyme. We're seeing similarities in this with COVID-19, SARS-CoV-2, in that we're seeing people initially demonstrating with respiratory issues, then we're seeing others with nervous system issues. We're seeing people with digestive issues and hearing loss and different forms of fatigue. So similar to Lyme disease, this isn't something we can classify as one thing. And we need to look at the individual as a whole and say, where is this affecting you and how can I help you as an individual? With Lyme disease, the best treatment plans are individually based. They're not protocol based. We're not looking to do the same thing for every patient because we realize every patient is having a unique experience. And I feel that in going forward with COVID-19, regardless of whether or not you're working with alternative medicine or standard medicine, we need to treat the patient, not the disease. The final similarity that I'm seeing between Lyme disease and treating COVID SARS-CoV-2 is something that I touched upon a moment ago around how this hits the emotions. Anytime we're not feeling well, our emotions come into play. No one likes to be sick. And when we have something that the media is telling us can be deadly, and at the same time most people are okay, and yet this happens and that happens, and we have all this conflicting information, and the whole world is in this pandemic situation right now, it can be scary, and it can make us feel very alone. And I've seen Lyme's disease patients over the years often feel very secluded within their illness because it feels like people can't understand them unless they're going through it as well. And with all the conflicting information, it can make them feel like, is this in their head? Are they really feeling this way? And I encourage you, one of the things that I've learned in helping people over the years and having, again, had Lyme disease myself, is trust your body. This could be an invitation for you to really listen to your own needs. The whole world right now is changing, and you don't have control over that. What you can do right now is listen to your body, and if you need assistance right now, reach out to doctors until you find someone who listens to you, and find someone who can help you as an individual find your path to healing. And I find often that when we can get quiet with ourselves, we often know what we need, even if we don't know the specifics. We know if we need more rest. We know if we need to change our diet. We know if we need to get some exercise. We know if we need support. We know if we really need to talk to someone. So listen to your needs for healing, and then talk to your loved ones about what you're going through. Being sick can be a very isolating experience, and we're already going through so much social isolation that it's really important for you to not feel alone within your process of healing. And while at times we may feel like we need to seclude, and obviously if you are sick, you need to isolate physically, that doesn't mean you can't pick up the phone or jump on Zoom with someone you love and just let them know what you're going through. And I have a feeling as things go forward that we're going to find support groups around those that are dealing with COVID, especially chronic COVID. So I would start to seek those out, or maybe start one yourself. I know from what clients have told me that there are many support groups on Facebook right now, and you are not alone. There are people all over the world dealing with this illness right now in different ways, and it's manifesting in different ways. And please seek out the care and the support that you need. I hope you found this video useful in looking at some similarities between Lyme disease and COVID-19 SARS-CoV-2, and I hope that you find your way to healing. And if you or a loved one are being affected by the situation, I do hope that you find the care and the support that you need. Blessings and good health. Thank you for watching.